CNA Dysphagia feeding assistance. Welcome to the quiz. Question 1. When assisting a resident with a sitz bath, what is the most important observation for you to make and report? Option A. How long the resident sat in the bath to ensure they don't exceed the ordered time. Option B. The water temperature to ensure it is warm, not hot, and comfortable for the resident. Option C. Whether the resident found the bath comfortable and soothing for their perineal discomfort. Option D. The color and amount of any drainage, bleeding, or clots in the water after the bath, as this could indicate a complication from hemorrhoids or postpartum/episiotomy healing. The answer is D. Abnormal findings like bleeding require immediate reporting. Option A is important but secondary. Option B is important for safety, but the observation of the outcome is more critical. Option C is subjective and not the most critical clinical observation. Option D is correct because abnormal findings like bleeding or discharge need immediate reporting to the nurse for assessment. Remember, we can take your CNA exam for you, remotely and undetected, and with 85% score guaranteed. No fails, no upfront fees, no deposit, pay only after results. Message us via number in bio to schedule your session. Question 2. A resident on fall precautions is attempting to get out of bed by themselves. What is the best way to approach this situation to maintain safety and dignity? Option A. Pull the curtain and ignore them so they don't become more agitated, hoping they will get back into bed on their own. Option B. Approach calmly but quickly, offer your arm for support, and say, "I'm here to help you. Let's make sure you're safe. Where were you thinking of going? Let me help you." This addresses the need while ensuring safety. Option C. Run to the resident and firmly push them back into bed, explaining that they are on fall precautions and cannot get up alone. Option D. Yell from the doorway, "Stop. Stay in bed. I'll be right there," to halt their movement. The answer is B. A calm, supportive approach respects dignity while ensuring safety. Option A is incorrect because ignoring them is unsafe. They could fall. Option B is correct because it calmly addresses the situation, offers assistance, and respects the resident's need to move while ensuring safety. Option C is incorrect because pushing them back can cause injury and distress. Option D is incorrect because yelling may startle and agitate them. Question 3. You are collecting a routine urine specimen. What is the correct procedure to ensure an uncontaminated sample? Option A. Have the resident void into a clean, dry collection container, like a hat placed in the toilet, then pour the urine from the container into the specimen cup, filling it to the required line. Do not let the cup touch the container. Option B. Take a sample from the urine already present in the bedside commode to avoid bothering the resident to provide another sample. Option C. Ask the resident to urinate directly into a sterile specimen cup, holding it in place. Option D. Send the entire bedpan with urine to the lab so they can collect the sample themselves. The answer is A. Using a clean collection container and pouring into the specimen cup minimizes contamination. Option A is correct because using a clean collection container, hat, and then pouring into the specimen cup minimizes contamination. Option B is incorrect because urine from a commode may be contaminated with water or cleaner residue. Option C is incorrect because it's difficult for the resident to aim directly into a small cup, and it may contaminate the outside. Option D is incorrect because sending a whole bedpan is impractical and unhygienic. Question 4. A resident who is verbally abusive and has a history of hitting caregivers during care becomes agitated while you are helping them dress. What defense mechanism should you use first to protect yourself and de-escalate the situation? Option A. Call for help to hold the resident still while you finish dressing them, as the task must be completed. Option B. Stop the task immediately, step back to a safe distance, and give them space to calm down. Use a calm, reassuring voice and avoid making sudden movements. Do not turn your back on them. Option C. Continue with the task as quickly as possible to get it over with, ignoring the verbal abuse and attempts to hit. Option D, restrain their hands gently but firmly to prevent them from hitting you, and continue dressing them quickly. The answer is B. De-escalation by creating space is the first step when a resident becomes agitated. Option A is incorrect because holding them down is not appropriate and may be considered abuse. Option B is correct because de-escalation is the first step. Removing yourself from immediate danger and giving the resident space can reduce agitation. Option C is incorrect because continuing risks injury. Option D is incorrect because restraining can escalate and is not allowed without order. Question 5. When providing mouth care to a resident who has their own natural teeth, what is the most important reason for brushing at a 45-degree angle to the gums? Option A. It prevents the toothbrush from slipping on the teeth and ensures a thorough cleaning. Option B. It allows the toothbrush bristles to reach under the gum line to remove plaque and bacteria, which is essential for preventing gum disease, gingivitis, and tooth decay. Option C. It is the most comfortable position for the resident and prevents gum irritation. Option D. It is the only way to effectively reach the back molars and clean the chewing surfaces. The answer is B. The 45-degree angle targets plaque at the gum line. Option A is not accurate. Option B is correct because the 45-degree angle directs bristles into the sulcus, the space between tooth and gum, where plaque accumulates. Option C is not the primary reason. Option D is not the main purpose. Question 6. A resident tells you they haven't had a bowel movement in 4 days and are feeling uncomfortable and bloated. What should you do? Option A. Encourage them to drink more water and move around if able, and report their complaint and the number of days since their last BM to the nurse promptly. The nurse needs to assess and order any interventions. Option B. Give them a cup of prune juice and wait to see if it works, documenting the intervention and outcome. Option C. Tell them it's normal to skip a few days, especially at their age, and not to worry about it. Option D. Immediately give them a suppository from the supply closet, as this is a common CNA intervention for constipation. The answer is A. Constipation requires nurse assessment before intervention. Option A is correct because constipation requires nurse assessment before any intervention. The nurse may need to check for impaction or order a suppository. Option B is incorrect because prune juice may not be appropriate without knowing the cause. Option C is incorrect because 4 days without a BM is not normal and can cause discomfort and complications. Option D is incorrect because suppositories require an order. Great job! Don't forget to subscribe. Bye!